All right, we've started, and we're YouTube live streaming a commentary on the debate over Obamacare between Senator Bernie Sanders and Senator Ted Cruz, who, like, I portrayed as like the ultimate constitutionalist versus the ultimate progressive. So it makes me really happy and really excited to see what this is going to have in store. Because it seems to be like a very emotionally influenced. There seems to be emotionally influenced arguments on a circle surrounding the whole debate because Obamacare is about healthcare and people's treatment and all. So I'm definitely eager to see how Ted Cruz reacts to whatever appeals to emotion Frank Sanders makes. Right. You should start showing some sympathy. Yeah, I think my prediction is that Senator Sanders is going to end up winning this debate because he can make the emotional argument that Ted Cruz can't. And Ted Cruz, I don't think he is as good of a speaker as Bernie Sanders is, but we'll see. Mm-hmm. Yeah. He definitely is very not unfamiliar with citation or citing, yes. Mm-hmm. Mm-hmm. Yeah, it's going to be really interesting. This is the debate I would have loved to see for the general election much more than what we got. Okay. So the channel streaming Fox News just switched over to a CNN stream. Alright, I'm going to turn the volume up. You're probably going to hear echo.
Affordable Care Act will question you in addition to questions from Jake and myself. As moderators, we will guide the debate and begin with
cool.
2-minute opening statements on what should happen to healthcare in America. Senator Sanders.
Let me begin by thanking CNN for sponsoring this debate, and let me thank all of those who are watching. Let me get right to the point. Yeah. Senator Cruz, like most Republicans, has said that he wants to repeal the Affordable Care Act, or so-called Obamacare. Let me tell you what that will mean to the American people. It means that if you are one of 20 million Americans who finally has received health insurance, forget about it, you're gone. You're off health insurance. And that means when you get sick, you ain't going to be able to go to the doctor. And when you end up in the hospital, you'll be paying those bills for the rest of your life, or maybe you'll go bankrupt. But the repeal of the ACA means that if you are one of 10 million senior citizens who today is struggling with the outrageous cost of prescription drugs, your prescription drug costs are going to go up on average about $2,000. What the repeal of the ACA means is that if you are suffering
any punches.
with cancer, with diabetes, with serious mental illness, you will be put into a position where you may be rejected from any insurance at all because you have a pre-existing condition. And by the way, women are considered a pre-existing condition by the insurance companies because they might have a baby. Is the ACA perfect? No. Nobody believes that it is, and nobody believes that we do not need to improve it. But the debate is whether we kill it entirely or we make improvements in it. And I will tell you, overwhelming majority of the American people say, do not simply repeal the ACA, make improvements. Last point. The United States is the only major country on earth not to guarantee health care to all people as a right. I believe we should move in that direction.
Are you like imitating Bernie Sanders' hand gestures?
We have got to go further and join
he does
every
do
other
the
major
gestures
country on earth and say, if you are an American, you are guaranteed health care as a right, not a privilege.
See, I don't like. I like Bernie
Thank you,
Sanders'
Senator
arguments
Sanders.
there. I don't
Senator
understand why he
Cruz,
lumped that
what's
in
with
with
healthcare in
American.
America?
With healthcare should be a right in
Dan, I think
America.
I had an opening
You don't have a
statement as
right
well,
to
so
other
I'll
people's
start with
other
that,
people's
which is
money.
just
You have a
simply
right to
say
your own
thank you.
liberties.
Thank
So
you
I
guys
disagree
for
with
hosting
that.
this. Thank you for Bernie for joining this, and thank you to CNN for hosting this. You know, often in politics we have debates that are sound bites that are 60 seconds or 90 seconds on a topic, and I appreciate CNN devoting real time to this issue because it matters. Healthcare is personal in a way that is different from most other political issues.
Wrong.
Healthcare affects our families. It's our moms. Healthcare is our kids. It's the future. It can quite literally be whether we live or die.
Uh-oh.
Forward, we have
My
got
stream
to...
is buffering. Oh, there we go.
And this is an issue where Bernie Sanders and I have fundamentally different approaches. Bernie and the Democrats, government. I better.
Well,
when you're
Ted
the
Cruz is
best
doing a
for your
good job
family,
making himself not
without
appear
government setting
unfeeling.
rules, without government rationing, without wait periods. And that's the fundamental divide we're having. You know, 6 years ago when Obamacare was being adopted, it's possible that reasonable minds could have differed on whether this was a good idea. But 6 years into it, we've seen the results. We remember Obamacare. A series of promises were made to us by President Obama. Number one, most infamously, if you like your plan, you can keep your plan.
Mm-hmm.
President Obama said that 37 different times. And 6 million people across this country discovered that was not true when they had their plans canceled against their wishes. If you like your doctor, you can keep your doctor. Again, millions discovered that wasn't true. And President Obama promised the American people the average family's premiums would drop $2,500. Not only wasn't that true, but the average family's premiums have risen $5,000. That's why people are unhappy with this disaster of a law, because it's driven up the cost of health care. It's reduced your choice. It's reduced your freedom. And this last election was a referendum on Obamacare, and the American people quite rightly decided this plan isn't working.
Senator Cruz, thank you so much. We have a lot of questions for both of you from members of the audience, but before we get to them, I want to ask about a pressing matter on Capitol Hill, and I'll start with you, Senator Cruz. House Speaker Paul Ryan said today that legislation to repeal and replace Obamacare would be done this year. On Sunday, President Trump said that a plan may not be rolled out until 2018. Not that it would, but that it may not be rolled out until 2018. Is anything less than a full and swift repeal and replacement of Obamacare a broken promise?
Listen, I think everyone agrees there is an urgency to honor the promises we made. You know, since Obamacare was passed, we've had multiple elections, 2010, 2014, 2016, where the number one issue in each of those elections was Obamacare. And, you know, what we're arguing here was argued in front of the American people. The Democrats said over and over again, if Obamacare is repealed, all of these people are going to lose coverage. Now, that's not true, and we're going to get into that. But that was the argument that was made to the American people. And 2010, 2014, 2016, I believe were a mandate from the voters. They said, we're tired of premiums going up. We're tired of deductibles going up. We're tired
I'd like to make any
of
commentary
losing our
on the
doctors of
logistics of what
less
they're saying, but right
choices.
now
So, yeah, should Congress
both
move
their arguments are
swiftly
very
to repeal
blatant.
Obamacare? Absolutely. Now,
They're just
nobody
coming out with their
thinks
opening
we're
statements.
done once Obamacare is repealed. Once Obamacare is repealed, we need common sense reform that increases competition, that empowers patients, that gives you more choices, that puts you in charge of your health care rather than empowering government bureaucrats to get in the way. And these have been common sense ideas, I would note, that for 6 years Republicans have been proposing. And for 6 years, Democrats have been fighting, saying no changes at all to Obamacare, even as people were hurting and losing their coverage. This election is about honoring the promises we made to the people who elected us.
Senator Sanders?
Well, the truth is that the Republicans are now in a panic. Because
He's
the
lumping
American
Ted Cruz in
people
with the
have caught
Republicans. I
on
like it.
that the absolute repeal of Obamacare, without improvements in it, without a plan to make it better, would be an absolute disaster. So when Ted talks about giving people choice, here's your choice. You got cancer and you go to the doctor and the insurance company says, we're not going to cover it. We can't make money on you because you have cancer. You have a pre-existing condition. And here's another choice you can have if we get rid of Obamacare. If you have diabetes and you're spending a whole lot on health insurance, the insurance companies will say, sorry, we're only going to spend X dollars because we got to make money off you. That's the function of private insurance. So do we have to improve the Affordable Care Act? Of course we do. But let us remember where we came from. Before the Affordable Care Act, as Ted probably knows, if you were a family of 4 during the 8 years under George Bush, your premiums doubled. So it's not like, oh, gee, just in America today, healthcare costs have gone up. They went up much higher before we had the Affordable Care Act.
Senator Cruz, do you want to respond to that?
You know, it is interesting to hear so much of the Democratic rhetoric that government controlling your health care is always justified by saying the insurance companies are terrible. Now, this is an example of what John Adams famously said, facts are stubborn things. Let's talk about some facts. In 2008, the 10 largest insurance companies in America made just over $8 billion profit. In 2015, those same 10 largest companies made $15 billion in profit. Insurance company profits have doubled under Obamacare. That was the result. Bernie helped write Obamacare. I don't think the federal government ought to be passing a law that doubles insurance company profits. And while those profits were doubling, what happened to the average American family? The average American family, your premiums have gone up $5,462. At the same time, the average deductible has gone up $5,000. For families that are struggling, you're getting less coverage, you're paying more for it, and your deductibles are higher. And you know who's making out like gangbusters? The insurance companies and those in government whose solution is let's have even more government control. This thing isn't working.
I find myself in agreement with that. He's right. The function of insurance companies is not to provide quality health care to all people, to make as much money as they possibly can. Ted, let's work together on a Medicare for all single-payer program. So we're finally going to get insurance companies, private insurance companies, all our lives. As you know, as the American people, we are the only major country on earth that allows private insurance companies to run the system. But it's not only the points that Ted made about the insurance companies. What he forgot to tell you, even adding insult to injury, is many of these CEOs of the insurance companies make outrageous compensation and get all of these severance packages, in some cases over $100 million. Ted, let's work together. We're going to get those insurance companies out of healthcare. We'll move to a Medicare for all healthcare program, guaranteeing healthcare to all people.
Thank you, Senators. Unless you want to agree to a single-payer system.
I would love to respond. Well, actually, what I still will say, Bernie, is I would love for us to work together going after Big Pharma. And in particular, taking on the FDA. Right now, it takes $2 billion to approve a new drug. Now, I've introduced legislation to reform the FDA process so that new health care, so that we can be curing diseases and we can be helping people. I would encourage you to join me in that legislation. Join me in Right to Try so that if someone has a terminal disease, the government won't tell them, you can't try this life-saving medicine because we forbid it.
Gentlemen, we could do this. We could do this all night. We're going to get to pharma.
I'm willing to look at it. If you're willing to look at taking on pharma, which is the greediest of many greedy corporate interests in Washington, and I'll tell you what, I'm going to introduce legislation to have Medicare negotiate prices with the pharmaceutical industry. I am going to introduce again legislation to allow Americans to buy less expensive medicine in Canada, the UK, and other countries. Let's take on the greed of pharma, substantially lower prescription drug costs.
And Dana, let me make a response to this, because this is a good discussion. The whole point of having an extended discussion is to, as you know, with drug reimportation, bringing in drugs from Canada and other countries, just a couple of weeks ago on the Senate floor, I voted with you in support of that, in support of allowing drug reimportation. It was the right thing to do, but I'll tell you, a much bigger barrier than that is the fact that, in the last 20 years, the FDA has approved only 3 child cancer drugs in 20 years because the burdens are so great. I introduced legislation that said if a drug is approved in another major country, if it's approved in Europe or Japan or our major respected partners, that the FDA's got 30 days to approve it here. We shouldn't be telling people with life-threatening diseases, you can't do everything you can to save your lives. That would be a great thing. We'd make news if you and I joined up on that.
But that is not the major problem. The major problem with the pharmaceutical industry is, you know what? They could double or triple the prices you pay for medicine tomorrow,
Senator Sanders,
and there is no legislation to control that.
Senator Sanders and Senator Cruz. Oh, hi.
Exactly.
So good to see you. We do want to talk more about that later, but I want to get to some of the questions from our audience. One of the most popular parts of Obamacare is, as you mentioned earlier, requiring insurance companies to cover people with pre-existing conditions. If Obamacare is repealed, 52 million Americans could lose that guaranteed coverage because of their medical histories. One of them is Neosha Ponder, who is fighting breast cancer and currently undergoing radiation treatment. Neosha.
Senator Cruz, if Obamacare is repealed, is there anything you can do to ensure that provisions are in place so that half of my paycheck won't be spent on health care?
This should be something Ted Cruz should know is coming his way.
I never smoked. I never drank a lot. I've lived a pretty healthy lifestyle. I fear that if I don't have Obamacare, if I'm not covered, then my pre-existing condition of breast cancer and remaining treatments will make it difficult for me to afford insurance. Senator Cruz, what can you do to protect people like me who are alive because of Obamacare?
Well, Neil, thank you for asking that question. And how long have you been diagnosed with breast cancer?
I was diagnosed on April 25th, 2016.
Wow. Well, you're doing great. Our prayers are with you. I'll tell you, my mom had breast cancer. And my mom was diagnosed in 2000. I sat by her hospital bed as she went through 2 surgeries, and it's a horrible disease, but 16 years later, thank God she is a survivor. And I will tell you, our medical innovation has been incredible dealing with breast cancer. So all of us, our prayers and thoughts are with you.
Thank you.
You asked about people who get sick and not wanting your insurance canceled, not wanting your premiums to go up. That's absolutely right. That is absolutely right. And if you look at every proposal that's been submitted, every significant proposal that's been submitted to replace Obamacare, to fix the problems in the healthcare system after Obamacare is gotten rid of, all of them protect people in your situations. All of them prohibit insurance companies from canceling someone because they got sick. They prohibit insurance companies from jacking up the insurance rates because they got sick or injured. Look, the whole point of insurance is none of us know if we're going to wake up tomorrow like you did earlier last year and discover we have a terrible disease. And we buy insurance, we pay our premiums just so we know that we'll be able to take care of that situation. So absolutely we got to fix it, and I'm confident that we're going to.
Senator Sanders, response?
That's a big question mark, though.
It's a direct contradiction to everything you ran for president on. What Bennett said is he wants to get rid of all federal mandates. Did you say that 100 times?
I didn't say it once.
I will, said Ted Cruz, I will get rid of every word of Obamacare. Excuse me. The only way that we are going to make sure that you, and we all wish you the best, are able to get the health insurance you need with a pre-existing condition is to make sure that no insurance company in this country can say no to you or to anybody else. Now, Ted thinks that's a terrible government intrusion. I think it is the moral and right thing to do. So when you hear Ted and other Republicans say, we're going to get rid of all of Obamacare, we're going to leave it to the states. Well, what do you think the states are going to do? You think they're going to maintain the ability to protect people with pre-existing conditions? Then we're going to go back to the obscenity of where we were before Obamacare was passed.
Senator Cruz, your response, and then could you just clarify, will you support anything that doesn't mandate people with pre-existing conditions continue to have coverage?
That's a good question.
Look, my response is, I said hundreds of times on the campaign trail, yes, we should repeal every word of Obamacare. But if you listen to the next sentence, I always said, we're not done yet. with health care reform, and we do that. We need health care reform and the principles of health care reform. They should expand competition. They should empower patients, and they should keep government from getting between you and your doctor. And I talked about all sorts of common sense ideas to do just that. And as I said, a proposal that is consistent in virtually every one of the pieces of Republican legislation that's been filed is a prohibition on insurance companies canceling people because they got sick. And you know, Bernie, it's easy to say to people, gosh, you're going to lose your coverage. What do the Democrats say to the 6 million people who had their health insurance canceled?
You're a good lawyer and you use words well. What you just said is cancel your insurance. Cancel your insurance, okay? That's good. But what happens if tomorrow you wake up and you go to the doctor and you discover that you have cancer? All right? You just discovered it. And the insurance companies say, hey, you're not a good deal for us. We can't make money off of you. You will not get that health insurance. So I think when people like Ted talk about repealing Obamacare, repealing government mandates, this is a government mandate, and it is a damn good mandate and a humane mandate.
And Senator Cruz, if you would answer Naosh's specific question.
Yeah, I did multiple times, Dan.
Okay, so you are saying that she will continue to have health care,
yep.
She and others who have pre-existing conditions, and you're going to make sure that that is a mandate and a requirement in whatever legislation you support?
What I've said is virtually all the Republican legislation that has been filed that the Democrats have opposed maintains a continuity of coverage so that insurance companies can't cancel policies. And, you know, the question I asked a minute ago that Bernie chose not to answer is, what do the Democrats say to the 6 million people who had their insurance policies canceled, who got a notification in the mail?
You had bad health insurance.
And not just the people who were canceled.
It's not a convenient answer.
Who can't afford health insurance because of Obamacare, who the deductibles are so high, the premiums are so high, they say, you know what, my family, we can't make it on this. And, you know, you talk about the people covered by Obamacare. Here's something most people don't know. Most of the people covered by Obamacare are on Medicaid. They jammed a bunch more people in Medicaid. I'll tell you what happens. People on Medicaid have markedly worse health outcomes,
Senator,
and people with private insurance.
Senator,
I'd like to see a lot more people on private insurance able to be insured for health care, rather than. But it's relevant. He's saying people are going to lose their health care. If you want health care, we want as many people as possible to be able to afford insurance policies that protect you when you get sick.
I want to just very briefly.
Go ahead.
If you listen carefully to what he said, if you go to the doctor tomorrow and you are diagnosed with a terrible illness, the insurance companies do not have to provide you insurance. That is what Ted said.
Yeah.
But he also said if you have an illness, it has to be
being very invasive.
But really, we are moving into an era where millions of people who develop terrible illnesses will not be able to get insurance, and God only knows how many of them will die.
So, Senator Sanders, you just heard Senator Cruz bring up an issue that a lot of Americans have out there, especially a lot of middle-class Americans who say that the Affordable Care Act has made it so that their insurance is unaffordable. One of them is in our audience right now. Her name is Melissa Borkowski. She's a nurse practitioner.
Ted Cruz could have hit more of a home run on that and say, like,
she and her husband are paying
make himself the hero, say, like, personally, I will fight for you in order to get you health care, but Obamacare is not the valid option.
Yeah. As he said, I'm a nurse practitioner. I've worked in healthcare for over 20
exactly
years
what
now.
Ted is saying.
Whether
he's right or not,
I need for myself or my family.
And I just felt like he
Last
could
year,
have
I had a
articulated
from pap smear and needed
Yeah, I feel like he could have articulated it better, though.
But our plan has a $13,000 deductible before it will cover anything. So I wasn't able to afford to get those tests done. So now I sit here wondering if I have an undiagnosed cancer, and that will eventually take me away from my 4 children. My plan premiums plus deductible cost over $25,000 for the year, and it covers little more than basic preventative services. Senator Sanders, my question is, why should my family be forced to pay so much money for an insurance plan that is essentially useless and doesn't do anything for me?
Listen. You asked a great question. The answer is, it is totally absurd. It is totally absurd. But the real question we should be asking, and Melissa is talking about an outrageous deductible, right?
Yes.
So it prevents you from going to the doctor when you should be going. The real question, which is never talked about or very rarely talked about, is why we end up spending as a nation twice as much per capita on healthcare as do the people of any other country. Now, if you were in Canada, you know what? You would get the healthcare that you need. If you were in the UK, France, Germany, Scandinavia, you would get the healthcare you need as a right of being a citizen in this country. The idea that we have policies like that, like the one you described, is clearly an outrage and should tell every American that we've got to join the rest of the industrialized world and guarantee health care to all people as a right. And when we do that, by the way, for the vast majority of the American people, the family incomes will go up.
Interesting.
Senator Cruz?
You know, Melissa, I'm sorry for the challenges you're facing. There are many people in America struggling with exactly what you are in the wreckage of Obamacare, with skyrocketing premiums, with deductibles that are unaffordable, and with really limited care. And I will commend Bernie for his candor. I mean, his view all along was that we need government-run and government-controlled health care for everyone. Mm-hmm. And indeed, as he said here tonight, he thinks other countries do it a lot better than America. He often points to Canada, the United Kingdom. He says, why do we pay more?
He's about to
well, there's a reason we pay more in those countries. We get a lot more and a lot better health care. Let me give you some basic facts. As I noticed in all the Democratic primary debates, there was no discussion of the facts on the other side. The United States, population controlled, delivers 3 times as many mammograms as Europe, 2.5 times the number of MRI scans, and 31% more C-sections. We provide more health care. Not only that, in the United Kingdom, for example, wait time in 2013, you waited 72 days for cataract surgery. You waited 89 days for hip replacement, 95 days for knee replacement. There are 3.7 million people in the United Kingdom right now on a waiting list waiting for health care. Whenever you put government in charge of health care, what it means is they ration. They decide you get care and you don't. I don't think the government has any business telling you you're not entitled to receive health care. That's why I think the answer is not more of Obamacare, more government control, more of what got us in this mess. Rather, the answer is empower you, give you choices, lower prices, lower premiums, lower deductibles, empower you and put you back in charge of your health care.
Senator Cruz, thank you. Senator Sanders, let me ask you just as part of Melissa's question. Florida, the state she's from, now offers fewer insurance options through Obamacare, through the insurance exchange. There was a nearly 25% decline in the number of insurers in 2017 nationally compared to 2016. There are 5 states that only have one insurer providing insurance on the exchange. What would you do to ensure that consumers have both choice and manageable costs?
Let me get back to Melissa.
No, it's buffering.
What would you do to ensure that consumers have both choice and manageable costs?
Let me get back to Melissa.
You want me to play it on my end?
No, it should start up soon enough.
What would you do to ensure that consumers have both choice and manageable costs?
Let me get back to Melissa.
Just give it a second. If need be, yeah, but I think it should start up again.
What would you do to ensure that consumers
No,
have...
we don't want to keep...
Over and over again.
Yeah, we don't want to keep hearing that line.
What would you do to ensure that consumers...
Exchange, there was a nearly 25% decline in the number of insurers in 2017 nationally compared to 2016. There are 5 states that only have one insurer providing insurance on the exchange.
Can you hear it?
What would you do to ensure that consumers have both choice and manageable costs?
Fair question. Let me get back. That'll get to you.
It's part of the question, though, because the competition's down.
If that's what it helps.
Ted talks about the problems that exist in other countries in terms of waiting lines. He talks about rationing. We have enormous rationing in this country. When you have 28 million people who have no health insurance, that's rationing. When you have people who can't afford to go to the doctor or can't afford to buy prescription drugs, 1 out of 5 Americans can't afford the prescription drugs their doctors prescribe. That's called rationing. Except there's no rule on that. There's no law on that. It's just people don't have the money to buy what they need in terms of health care.
to answer your question, Jake, what I have long supported within the context of Obamacare as we move toward a Medicare for All single-pay program is a public option. There should be a Medicare-type public option available in all exchanges in all states in this country. And I think that would substantially lower the cost of health care in this country and provide real competition to the private sector.
Senator Cruz?
Well, Jake, I think the question you asked is a very good one, and you're right that choices have gone down dramatically. Indeed, I don't know if the cameras can see this, but in 70% of the counties in America, on Obamacare exchanges, you have a choice of one or two health insurance plans. That's it. 70% of the counties in America. It's interesting. You look at this map. This also very much looks.
Nope. I got a buffering.
Far right. Now, Bernie likes talking about a public option. That's another way of saying government control of your health care. It's socialized medicine, and what does it mean? Every country where it's been applied, you've seen rationing, you've seen government deciding, especially seniors. Seniors, you don't get the health care you need. Now, Bernie mentions Canada quite a bit. I know quite a bit about Canadian health care. I was born there. Bernie, that may be the best argument against your position is look what it produced.
Look at the results. Yeah, that's right.
But, people vote with their feet. In 2014, over 52,000 Canadians left Canada to get health care in the United States and other countries. I'm reminded of a comment Ronald Reagan used to say about East Berlin, about the Berlin Wall. He said, the funny thing the leftists never seem to notice, the machine guns all point one direction.
I have that.
Everyone was fleeing communism and coming to freedom. If you look at socialized medicine, people leave their tens and hundreds of thousands every year, leave socialized medicine countries because they want to get a hip replacement, a knee replacement. The governor of one of the Canadian provinces came to America to get heart surgery, and he was a governor in Canada. And by the way, in your home state of Vermont, your hospitals advertise with Canadian flags, come to American hospitals, you'll get better health care. I don't want to mess up our health care. I want patients, all of us, to be in charge of our health care, not government deciding what health care we get.
Government deciding. Now, government doesn't decide in Canada or any place else. And by the way, as you well know, Canada had for many years a conservative prime minister. The United Kingdom had for many years a conservative prime minister. I don't see those countries junking their health care systems, in which, by the way, poll after poll shows, not that they don't have problems. Of course they have problems. Every health care system in the world has problems. But I am not seeing those countries junking their universal health care system, which provide health care to all of their people at 1/2 the cost per capita that we do. I don't see conservative prime ministers doing that to go to the American health care system. Our system is wasteful. It is dysfunctional. It is incredibly bureaucratic. You talk about choice. You have people who have to argue with insurance companies for days before they can get the care that they need.
See, Bernie, you say wasteful, and I say people exercising free choice. You're right. We could cut costs here if we do like Europe and cut the number of MRIs, the number of mammograms. If we cut, you look at the elderly in much of Europe. The elderly here, when the elderly face life-threatening diseases, they're often treated in the intensive care unit. In Europe, they're often put in palliative care, essentially doped up with some drugs and said, well, now is your time to go.
Oh.
I don't expect the government to be saying that. And let me give, since you laughed at that, let's actually talk facts, because facts matter. Yeah. So let's talk about, for example, a couple of stories from the United Kingdom. In Glasgow, Scotland, the Queen Elizabeth University Hospital was so overburdened this past January, it turned away 3 women who were in labor because they couldn't take care of them. In Worcester, England, a man was left on an ambulance gurney for 5 hours before his heart attack was diagnosed. And he waited 7 hours before he received a stent and angioplasty. In a hospital in Essex, doctors twice canceled a potential life-saving surgery for a patient with esophageal cancer because there were no free beds in the intensive care unit. One more example in Wales. An 82-year-old woman who had fallen waited 8 hours on the floor before an ambulance arrived. Her daughter sat beside her in the ordeal, described it as one of the longest nights of our life. This is what happened when government takes over health care. Every example on earth. The result is rationing and waiting periods, and you, the citizens, being told, no, you can't have the health care you want and deserve.
And in America, we do rationing in a different way, Ted. The way we do rationing is, if you are very rich, you can get the best health care in the world, I believe, right here in the United States. We should be proud of that. But if you are working class, you are going to be having a very difficult time affording the outrageous cost of health care. That's what Melissa just told us a moment ago. Now, estimates different, but let's be clear about this. Every single year, tens of thousands of our fellow Americans die because they don't go to the doctor when they should. You gave some examples about the UK. Let me give you some examples. Here in the United States, I talk to doctors in Vermont, all over this country. And what they tell me, patients come into their offices very, very sick. And they say to the patients, why didn't you come in here a year ago?
I got to back up.
When you felt your tumor, when you felt your problem, when you were sick, why didn't you come in here? And people said, I didn't have any insurance. Or my deductible was so high, I couldn't go. We just heard that story a moment ago.
I think I got to back up. It's playing an advertisement right now.
And others end up in the hospital at outrageous costs for illnesses that could have been treated initially at far less cost. So please don't tell me about rationing. This country has more rationing than any other industrialized country on earth, except the rationing is done by income. And working class people and poor people today are suffering as a result of that rationing.
We're going to take a very quick break. The debate will continue right after this with Senators Ted Cruz and Bernie Sanders. Stay with us.
Bummer. The other debates having commercial breaks.
No, I mean... Even
all right, commentary break then. We get to talk about this.
Yes. And I'll let you know when it's back up.
All right, cool. That was fascinating.
Mm-hmm. It's kind of interesting. What I'm hearing is you got... I mean... Yeah, they started out with like cookie cutter arguments. Like Ted Cruz started with his, and then Bernie Sanders started with his, and then they went from there. I think that's pretty intriguing. So
yeah, they definitely came out with broad swings, and then I liked how they started working through the different people asked specific questions and all. The thing that I don't understand is I wish Bernie would have had a better comeback against the argument about all those anecdotal cases that Ted Cruz brought up, because you don't see that happening here.
I think what Bernie should have said that those were isolated cases due to extreme circumstances. Now, I mean, it does happen in the United States where there's certain budget cuts in certain areas, and it would take a very long time for the cops to arrive to an incident for a certain area. But what Bernie is trying to say is that if you're rich, you just pay, and then they everything's taken care of. Mm-hmm. But with the middle class and the poor, you have to do an exceptional amount of work to get what you need. Even for me, that I have to handle my health insurance, and even though it's through Medicaid, I have to get through all these different all this paperwork done. Mm-hmm. And what Bernie is saying, that you don't have to pay the premiums or co-pays. Mm-hmm. All you have to do is file out one form. It's the 1040, which is what you do to file your taxes.
Yeah.
And then through your taxes, you pay your taxes and no questions asked.
Right.
And what he's trying to say is that many other countries do this. Mm-hmm. And with certain regulations of what the hospitals can do, and with and all that, mm-hmm. that you pay, and then you're taken care of. Mm-hmm. And so there's no greed behind health insurance.
Mm-hmm.
So that's what he's trying to say. Ted Cruz is saying, well, the government is very inefficient at its job.
The stream is back for me, so I'm going to turn the volume on.
Right. I own 5 fantastic Sam's hair salons. We employ between 45 and 48 employees. My original plan was to open more salons and employ more people. However, under Obamacare, I am restricted because it requires me to furnish health insurance if I employ more than 50 people. Unfortunately, the profit margin in my industry is very thin, and I'm not a wealthy person, so it's impossible for me to grow my business. My question to you, Senator Sanders, is how do I grow my business? How do I employ more Americans without either raising the prices to my customers or lowering wages to my employees? LaRonda.
Okay. Well, you own 5 salons.
That's correct.
And you employ close to 50 people.
Just under.
And what kind of health insurance do you provide to them?
None.
You provide no health insurance to them?
Correct.
Let me give you an answer you will not be happy with. And that I think that for businesses that employ 50 people or more, given the nature of our dysfunctional healthcare system right now, where most people do get their health insurance through the places that they work, I'm sorry. I think that in America today, everybody should have health care. And if you have more than 50 people, you know what? I'm afraid to tell you, I think you will have to provide health.
So my question is, how do I do that without raising my prices to my customers or lowering wages to my employees?
I think the difficulty is, and I'm not much of an expert on hair dressing in general.
I'm just one in small business.
I know. But my guess is one of the problems that we have is there may be somebody else in Fort Worth who is providing decent health insurance to their employees. And they are in an unfair competitive situation regarding you. You can compete and maybe charge lower prices, get business, but they, on the other hand, may be providing decent health insurance.
I think you'll find the profit margin in my entire
industry. Maybe. I certainly don't know, about hair salons and so forth. But I do believe, to be honest with you, that if you have more than 50 people, yes, you should be providing health insurance.
Senator Cruz?
He's going to be blunt on that.
Sharing your story. And it's good to see a fellow Texan here. And, I've got to say I've got a very different view than Bernie. I think actually what Bernie told you is the same thing President Obama said. It's the same thing Democrats have said, which is that you, the small business, you're apparently a bad actor because you're not allowed to manufacture money. Let me introduce you all to 2 terms that have become really common. 29ers and 49ers. 29ers are the millions of people across this country that have been forced into part-time work that used to have full-time employment and are now working 29 hours a week because Obamacare kicks in at 30 hours a week. And a lot of them are people, they're single moms, they're teenagers, they're immigrants, they're people who are struggling, and then 49ers. There are millions of small businesses in the exact situation you're in. A couple of months ago, I was out in West Texas, was visiting a dairy farmer, driving around the dairy farm. I got to say, interesting smells on the dairy farm. Kind of reminds me of Washington. He said, you know how many employees I have? I said, no. He said, I've got 49. He said, you know why I have 49? I said, yes, I do. Because Obamacare kicks in at 50, and he said, I could hire 20 or 30 more employees right now. But Obamacare would bankrupt my business, and that's millions of small businesses. So we're here at GW. Let me speak for a minute to all the young people. When you come out of college with way too many student loans, my guess is you'd like to get a job. And millions of small businesses being told by the Democrats, tough luck, we don't care if it drives you out of business, that's taken away opportunity, and it's hurting, in particular, the most vulnerable. It's one of the most damaging things about Obamacare.
Senator Sanders?
Rhonda, let me ask you a question. What happens if one of your employees becomes ill? What happens? What happens if one of your employees, as happens in every part of the country, gets diabetes, gets cancer? What do they do if they don't have any health insurance?
I can't really answer that question, but I can tell you that because the premiums have gone up so much this year, and because I don't qualify for any kind of government subsidies, I don't have, for the first time in my life, insurance. It's just not affordable. Unfortunately, the prices of my services just don't warrant it.
Let me just say this, two things. Number one, as I mentioned earlier, it is absolutely true that the cost of premiums are going up. No argument. They went up even higher during the period of George W. Bush. So it's not like, oh, gee, for the first time in American history, premiums are going up. Number two, Ted mentioned part-time work, the 29 as well. There are fewer part-time employees today than there were before Obamacare. Okay? So here is the point. The bottom line is the situation you described is honestly absurd. You should not be going around without health insurance. Your employees should not be going around without health insurance. We should not be spending twice as much per person on health care as do the people of any other nation. Please join me and fight for a Medicare for All program. Are you looking forward, by the way? I'm not going to ask you your age. But are you looking forward maybe when you get to 65 to get Medicare? Would that be of help to your family?
I expect that will probably happen.
Good. Well, I certainly hope it does, and I hope Medicare is still there, despite the efforts of Senator Cruz and others, so that when you at least reach 65, you will be able to get a decent health insurance program.
Well, Bernie, since apparently I'm now trying to kill the elderly, let me ask
the Zodiac killer, so.
When you heard that her premiums had skyrocketed, that she can't afford health insurance, you kind of said, well, premiums always go up.
Oh, no. I'm buffering again.
It's a problem.
I mean, let me ask you, why did President Obama look in the eyes of the American people and promise LaRonda that her health insurance premiums would go down $2,500 a year? Was he telling the truth when he said that, and were you and the other Democrats telling the truth when you echoed his promise to the American people?
Well, Ted, for a start, as everybody knows, healthcare is pretty complicated. I think President Obama is an honest person, and I think based on his assessment, that's what he believed.
Was it true?
But turns out not to be true, but it turns out to be that under Bush, premiums went up higher, not a new thing. And the real question we should be talking about is why we do spend so much money on healthcare. And that means that we have to appreciate that we are spending hundreds of billions of dollars every single year, not on healthcare, but on administration and bureaucracy. You know how much money it costs to bill you? You got people, hundreds of people in large hospitals, they're sitting around not providing health care. They're working on paperwork, driving you crazy when you bring forth a claim. So we have to figure out how we have a simple system that guarantees health care to all people. When we do that, you and your employees will all have health insurance.
Well, there is an area actually where we agree, which is there is way too much paperwork with healthcare. There's way too much complexity. I'll tell you, when you talk to doctors, when you talk to nurses, they say, I don't get to practice healthcare anymore. I spend all my time filling out paperwork, all my time. Now, where the paperwork comes from is the government. It comes from Obamacare. In fact, there's some amazing stats I'm going to go back and get because they're really quite powerful. If you look at the paperwork impact, Obamacare's rules alone, and by the way, the Obamacare rules are 20,000 pages. They're taller than 7 feet tall. They generate $51 billion in costs and more than 172 million hours of paperwork compliance. Let me put that in perspective. What does that mean? That would take 80...
Buffering again?
Under Obamacare, that's roughly the entire population of Miami Beach, Florida, doing nothing
but
plus get government out of the business of dictating and controlling health care.
Well, that is right. There is far too much paperwork.
And my computer's buffering.
If you look at the paperwork.
Here, let me start playing on my end.
Obamacare's rules alone, and by the way, the Obamacare rules are 20,000 pages. They're taller than 7 feet tall. They generate $51 billion in costs and more than 172 million hours of paperwork compliance. And let me put that in perspective. What does that mean?
$1 billion
86,200 employees working full-time, 2,000 hours a year.
Decision. Very simple. Is health care a right of all people? Is it or not?
No.
Ted doesn't think it is.
Yes.
I don't think it is
if we
because
agree on most Americans do that it
you
is
don't
a
have a
right
right to someone else's profit that they make,
with
someone else's
high
money,
quality in a
and that's consequently what it is.
I happen to believe that care is a popular program. It works well. Right now, you get it at 65. I think every American.
Senator Sanders, I want to pick the discussion up right there, if I may. Senator Cruz.
Let me make a real quick point, just because I think it's nice having the back and forth and the
lovely,
live. But
absolutely.
One thing Bernie said that I think suggests maybe an area we could work together. You were talking about paperwork from insurance companies. I agree. There's way too much paperwork from insurance companies. I'd like insurance companies to have less power and patients to have more power. So maybe you and I could agree on a common sense reform of allowing LaRonda to purchase health insurance in any of the 50 states. Right now, she's a Texan. It's illegal for her to purchase health insurance.
I'll remove the state lines. Hillary Clinton actually also wanted to remove state borders in order to increase competition. So that's a policy position where she and Donald Trump agreed on.
Yeah. Is it still buffering on your end?
It's buffering again. Like my whole computer is derping out now.
do you just want me for the rest of the session?
You can go ahead and play it.
All right.
Senator Cruz.
Let me make a real quick point, just because I think it's nice having the back and forth and the
lovely,
live. But
absolutely.
One thing Bernie said that I think suggests maybe an area we could work together. You were talking about paperwork from insurance companies. I agree. There's way too much paperwork from insurance companies. I'd like insurance companies to have less power and patients to have more power. So maybe you and I could agree on a common sense reform of allowing LaRonda to purchase health insurance in any of the 50 states. Right now, she's a Texan. It's illegal for her to purchase health insurance anywhere else. That would give her choice. If she doesn't like what the Texas companies are offering, she can go to Oklahoma, she can go to Florida, she can go to any other state. That creates a 50-state national marketplace. It drives down costs. It increases choices. Why don't we stand together against the insurance companies and agree on that reform?
Well, I think standing together for a Medicare for all single-payer system is a lot better idea. Because when you have the idea that Ted was talking about, this is a race to the bottom. And what you're going to end up with, some insurance company in Mississippi or someplace, they're going to provide you insurance. But you think your deductibles are high now, it will be a lot higher. Look, Ted, and you're right, this is a good discussion, all right? And here is the issue. Ted, let me ask you a question.
Sure.
Is every American entitled, and I underlined that word, to health care as a right of being an American? Yes or no?
I'm glad you asked that. Right is a word you use a lot. Let's talk about what rights are. Rights mean you have a right for government not to mess with you, for government not to do things with you. If you look at the Bill of Rights, free speech means the government can't silence you when you're speaking. Religious liberty means the government can't control who you worship, what your faith is. The Second Amendment means the government can't take away your guns. Those are rights. What the Declaration of Independence said. We hold these truths to be self-evident, that all men are created equal and that they are endowed by their Creator.
He's basically saying, and I know you disagree with this, Don, but he's basically saying that, in summary, that rights involve liberties. Rights involve what government doesn't infringe upon for you. Rights don't include what the government can provide for you. That becomes a very nebulous and slippery slope if you do that.
And people like LaRonda who can't get health insurance, can't afford premiums, you're denying her what you say is her right.
Well, two things. You didn't answer
you remove the
question, although I interpret your question to be
you remove government control.
No, that's not what I said.
Corporate control.
I heard the Bill of Rights. I got the Bill of Rights.
Care is a right.
She has access. But you don't have enough money.
Your doctor
but
Bernie's saying we can keep government accountable, but we can't keep the corporations accountable. That's what he's trying to say.
$5 million for a house? Sorry. Access.
But has government really ever stayed accountable when you develop that kind of system?
Get the health care that they need.
And they can't under Obamacare.
Second of all, Some people have problems. No question about it. I'm not arguing with you on that, Ted.
I don't
but
know.
Don't argue
I feel
with
like,
me
though,
when I tell you that 20
the
million
corporations
more
keep
people
themselves
did get
accountable
health
by wanting
insurance,
to provide
right?
the best
We
type
used
of
to have
care and
48
competing
million
with
people
each
in this
other, so
country
they don't
who
have to
had
be
zero
held
insurance
accountable.
before Obamacare.
Sure.
Now that number much too high.
I mean,
It's 28 million.
They
Last
like the money.
Ted talked to the young
Well,
people.
obviously, though,
And he said,
that's
once you go
an
out
argument
with
that both
enthusiasm, go out and
Bernie and
get a
Ted
job, he's
sympathized on, is that there should be
But
policy
under
in place
Ted's ideas,
ensuring that
if
that
Obamacare
insurance
is
companies
repealed,
have to
right now,
or
if you're
provide
under
health care for
26,
people with
you can stay in your
really bad
parents'
illnesses.
insurance program.
So obviously
That's
there
one
has
of
to
the
be
things
some
we did
policy
in
in place
Obamacare.
where the government
Good
needs
idea.
to oversee
Ted would
that.
repeal
But
that. So as you
but
go out
outside
into
that
the real
realm,
world,
I just
be very
to
careful
the
about not
way
having
I
that.
perceive it is
Senators,
that
I
don't have any
corporations
tell
will
our audience
hold
we're gonna
themselves
take a quick
accountable
break.
through
We have a lot
competition
more to discuss.
much more
More of
capably than
CNN's
government will hold
debate
itself
night and the
accountable in
future of
providing health care.
Obamacare right after this.
Well, right when you were just finished saying that, they've gone to a commercial break.
Oh, okay. All right. So
I've heard the libertarian, like there's you got the authoritarian, you got the libertarian argument and it's the libertarian argument is you give the corporations freedom and it will trickle down to normal people and it will help everybody. The more authoritarian, the specifically left-wing authoritarian argument is, well, we create big government, and that keeps the corporations in check to make sure that they don't screw over everybody else, and furthermore, that will help everybody. Now, that's obviously an overgeneralization of each side. I mean, there's obviously little specifics that can be broken down depending on the situation and things like that. Because I might have just described communism right here, because communism is a left-wing authoritarian viewpoint. But like democratic socialism is very left-wing, but significantly less authoritarian. You brought up on your Facebook page. It's that chart. You got the left wing, right wing, and then authoritarian and libertarian, and you answer all these questions and wherever you end up. Well, like for me, I'd be like left wing. Actually, I think this is left. And you're right. And then it's like a little bit authoritarian. Like it's like over there. And what it basically means is that the government doesn't have complete control over everyone's lives, over everything, but there are certain aspects of the economy that we don't believe should be privatized, like college and healthcare. And I think there's one other thing, and military, and I think we don't believe that people should necessarily make huge profits over the military. But that's obviously not the point here. This is the healthcare. I mean, we don't think that companies should be in control of the healthcare because if them being a business, their focus is more on how do I make the most money.
Right.
And we don't think that corporations should control, we don't think that the corporations should control that. If we give the government that control and the accountability, so it's not like we give the government control and then it immediately that doesn't always immediately translate to, well, then the government has complete freedom to do whatever they want over your health insurance. So we would, and what Bernie would do is have regulations on the government, because if they're going to have all this power, they're going to have all this responsibility, and that has to be preset beforehand. And that's the big thing many libertarians miss, is like we say, well, we want a single-payer healthcare system. Well, what many libertarians miss is that we also want certain regulations of the government so that the government doesn't destroy everything. Anyway, it's the commercial break is over. So
okay.
Welcome back to the CNN Healthcare Debate with Senators Ted Cruz and Bernie Sanders. Senators, thanks so much for participating here. I want to ask you, since Obamacare was enacted, governors of 31 states plus the District of Columbia have opted to expand Medicaid through federal funding, providing insurance to 11 million low-income people. One of the Americans who benefited from the Obamacare Medicaid expansion is Carol Hardaway of Salisbury, Maryland. Carol?
Thank you. I have multiple sclerosis, but could not afford insurance. Without the treatment or medications I need, I had problems with walking, with my speech.
Give it a second.
We refused to expand Medicaid to Maryland, and within 2 weeks, I started receiving treatments through Medicaid, and am now well enough to work as a substitute teacher. Senator Cruz, can you promise me that you and the Republican leaders in Congress will actually have a replacement plan in place for people like me who depend on their Medicaid? In other words, I like my coverage. Can I keep it?
Well, Carol, thank you for sharing your story, and congratulations on dealing with MS. It's a terrible disease, and congratulations on your struggles dealing with it. You know, if you look at Medicaid, more than half of the people who've been covered under Obamacare have been under Medicaid. And the problem is Medicaid is a profoundly troubled program. And so it may be working well with you. But I'll tell you nationally, the health outcomes under Medicaid are really poor. Nationally, 54% of doctors won't take new Medicaid patients. Nationally, dental care appointments for moms are denied at a 63% rate on Medicaid. The denial rate for private insurance is 4%. And Medicaid patients are almost twice as likely to die from medical treatment as those with private health insurance. The solution for people who are hurting, I believe, we should have a system that allows as many people as possible to be on the private health insurance of your choice rather than Medicaid, because the Medicaid outcomes are not working and people are suffering. And what's happened also, it's really quite striking. Because Obamacare dramatically expanded Medicaid, many of the people who had been on Medicaid, many of the people who were really suffering and needy, have found their wait times increasing. In fact, in Illinois, on Medicaid, over 700 people have died on the waiting list for care for Medicaid. So I'm glad that you're receiving health care. I can tell you a great many of the people on Medicaid aren't, and I'd much rather see a system where we can have millions of those on Medicaid getting health insurance. And the only way they can is if we have competition so that rates are lower so that you can afford to have health insurance.
Senator Sanders.
There's the competition that
we heard from a woman who runs a hair salon in Fort Worth who can't afford to provide health insurance to her workers and for herself. We hear a story now about a woman who has to leave her own state, go to another state, because that state is providing Medicaid. My friends, you are living, I know you don't know this, by these stories. You're living in the wealthiest country in the history of the world, where the rich are becoming phenomenally richer, while we have 43 million people living in poverty and the middle class is in decline. These stories are obscene. They should not be taking place in the United States. Now, are there problems with Medicaid? Of course there are. But I will tell you something. To those Republican governors around the country who told poor people that they would not be able to, for the first time in their lives, in many instances, get access to health care, to be able to go to a doctor when the federal government paid for the first 3 years at 100%, I hope that those governors sleep well at night, because I don't know how many people lost their lives as a result of their decision. So once again, what we are looking at is a dysfunctional system. We spend more, we get less. People who work hard have no health insurance. People have to move from one state or the other. This country finally is going to have to do, in my view, what every other major country does. And yes, I believe, Ted, health care is a human right. And I believe that this country has got to join every other major country and say, you can stay home and get quality care because you're an American. You can run your small business well and get care because you are an American. That is where we have got to go.
Well, you know, when Bernie says, well, Medicaid has problems, you want to talk about people who lost their rights. 742 people in Illinois were put on a waiting list for Medicaid after Illinois expanded its Medicaid, Barack Obama's home state, and they died.
Wrong.
Awaiting care under Medicaid. Why? Because Medicaid is ration care, those wait lists. You know, Bernie likes to talk about Medicare for all, but let me be clear what his program is. It's Medicaid for all. It is rationed care nationally. And you want to know what that looks like. He keeps pointing to other countries. Let's look at, for example, the United Kingdom.
I just like that.
The United Kingdom, a 2001 report, noted that 39% of women over 80 in the United Kingdom receive surgery for breast cancer, compared to 90% of the women under 50. And that women under, or
for a second, I legitimately thought Bernie was saying that.
2.5 times more likely than those over 75 to receive cancer.
Wrong.
It's buffering. Hold on. Wait.
Wrong.
Cancer treatment.
Wrong.
More than 80% of older patients in the United Kingdom believe they're.
Oh, now I'm getting buffering. Hold on. Come on.
All right, I'm not, so I can start up if you want.
Wait for it.
I'm waiting. Wait for it.
As soon as I press the refresh page, then it starts, but then I refreshed it. Hold on.
Yes.
You were the chosen one!
You like this one.
These nuts. Got him!
Oh my gosh.
You can't handle the truth.
Furthermore, what we have.
Oh, come
Oh,
on.
that was that. You can't handle the truth. That would have been so good in so many contexts tonight.
Yeah. Come on. It just worked for a second. Why don't you can just get the audio? I don't need the video. Come on. Are you...
Still buffering for me as well, so. Maniacal laugh.
Yes.
Let's get doctors out into the areas where we need them.
Let me just jump in if I can. Carol, just shake your head. Did Senator Cruz, your former senator, did he answer your question? No, he did not. The question was, Senator Cruz, can you promise me that you and the Republican leaders in Congress will actually have a replacement plan in place for people like me who depend on their Medicaid? She got Medicaid through the
all night.
Obamacare
Skirted around this, and I wish you would just
Medicaid.
answer
We've all heard you criticize
straightforwardly.
Medicaid. What happens to
The
Carol?
answer might be no.
Well, what I said
be the answer.
is that Medicaid isn't working for millions of people, and Obamacare made Medicaid worse by expanding the wait list, by jamming more people on it. You want to talk about replacement? There's widespread agreement on replacement plans. Number one, allowing people to purchase across state lines, giving you more choice. Now, Bernie said he opposes that. He doesn't want to let you buy insurance in other states. Number two, expanding health savings accounts so you can save in a tax-advantaged way to meet your own health care needs. Number three, making health insurance portable so that it goes with you from job to job. I imagine, ma'am, at some point you had insurance with a job. If insurance was portable right now, federal tax law incentivizes most of us get our insurance from the government. And if you lose or not from the government, from our employer, rather. And if you lose your job, you lose that insurance. One of the best solutions to the problem of pre-existing conditions is making health insurance portable so it goes with you. You know, when you lose your job, you don't lose your car insurance, or your life insurance, or your house insurance. There's no reason to lose your health insurance. And if your insurance is portable, it goes with you, it's affordable, you have choices. Now, notice Bernie's solution. We want more doctors. We all agree on more doctors. He says, well, the government needs to hire more. I can point to something that works on that. In Texas, we passed tort reform. We fundamentally limited lawsuits and lawsuit abuse. And you know what we've seen? We've seen the number of doctors increasing dramatically. We've seen medical malpractice premiums dropping. Those are the kind of solutions supported at the state level that will result in more doctors. But Obamacare is discouraging people from going to medical school and training to be doctors.
Well, Ted, I didn't want to raise it, but you brought it forth. Do you know what state in the country, and I don't blame you for this, but what state in the country has the highest rate of uninsured in America? By far, it is the state of Texas. And by the way, may I say proudly that Vermont is number 2 in terms of the percentage of people who are insured. We have relatively few who are uninsured. And by the way, amazingly enough, do you know what state of the country has the highest rate of people who are insured? It is Massachusetts with Romney Care, which was the prototype for the Affordable Care.
Well, the nice thing, Bernie, again, people vote with their feet.
That was a little too late.
And for north of a decade now, roughly 1,000 people a day have been moving to Texas because we have an environment that allows people to get jobs. And so people vote with their feet. And you're right, there are states. Vermont is a lovely state. Doesn't have a ton of diversity. Doesn't have nearly the populations Texas has, that are populations that are just starting. When my dad went to Texas in 1957, when he was 18, he couldn't speak English. He was from Cuba. He had $100 in his underwear. He washed dishes making 50 cents an hour. You know what? He didn't have health care. But he came to go to the University of Texas. He came to get opportunity. That job
in his underwear
enabled him to get another job where he could get health care. That's a much better solution. Create an environment where you don't tax the living daylights out of people. It's why people choose to be where they get
health care. We're all happy that under Obama we created 15 million new jobs in the private sector.
Senators, I want to get to more audience questions, and this one is about the fact that the Affordable requires that all insurance plans cover what the law calls essential health benefits. This includes maternity and delivery costs. We have a question on what will happen to that coverage for Maria Shahid-Rowe, who was pregnant with her second child. Maria?
Trump and Hillary.
I'm a nursing student at the Medical University of South Carolina, and I'm concerned about the implications that repealing the Affordable Care Act will have on women's health, and specifically for pregnant women. So I'm 5 months pregnant, and I actually qualified for Medicaid due to being a full-time
student. So what did you do all throughout?
My husband works for a church. We live on a very modest income at the moment. Senator Cruz, what policies do you have in place to protect pregnant women from losing their health coverage, either due to being considered having a pre-existing condition or from being charged higher insurance premiums than men?
Well, congratulations on your new baby. Is it a boy or girl?
It's a surprise.
Oh, well, wonderful. and you said you have an older child. What's your older child?
We have a 2-year-old son.
What's his name?
Samson.
Oh, well, maybe you'll have Delilah, and that'll be,
Delilah, you referenced
how
Delilah.
Wonderful, and congratulations.
Thank you.
Heidi and I have two little girls at home, and it is a wonderful, wonderful thing. Listen,
we use them in our political campaign ads sometimes.
But here's how Obamacare worked. You had a lot of politicians in Washington who said we're going to mandate every coverage on Earth. And it sounds really good. I had a conversation a couple of years ago with a gentleman in Amarillo, Texas, who told me the story about his 101-year-old aunt who had just had her insurance canceled. What's her name? And she said the reason it was canceled was that it didn't cover maternity care. Now, this fellow laughed and said, you know what? My aunt is 101 years old. She doesn't really need maternity coverage right now. We should have a system, I believe, where you can choose to get the policies that meet your needs. And the impact, especially for young people, of all the mandated coverage. You know, it's interesting. The Democrats' view, they're big on talking about insurance coverage. But it's a little bit like giving everyone a bus ticket when there are no buses. What we should care about is access to health care, not just insurance per se. And what's happened under Obamacare is that millions of people can't afford it. We should be concerned about people being able to afford health insurance, and that means giving them the choice in 50 states to choose a policy. In your instance, you would choose a policy that had maternity coverage, but someone else who right now kind of can't afford it might choose a different policy. And when government mandates it, those choices go away.
Senator Sanders, your response?
what Ted is really telling you is they will not guarantee coverage for you. And not every pregnancy is planned. And if a woman pregnant woman before Obamacare, you know what you would consider to be? A pre-existing condition. And now, why would an insurance company want to provide care to you when having a baby is a fairly expensive proposition? You don't make money doing that. And Ted keeps talking about these mandates. So let's be clear again what Senator Cruz and his Republican friends want to do. They do not want to guarantee that women who become pregnant will be able to get the health care and the prenatal care that they need, which is a terrible thing, by the way, because we have one of the highest infant mortality rates in the industrialized world. He says to young people who today are on their parents' program, you're out, you're on your own after you leave college.
So I understand why you wouldn't just go to another health care provider. He says that if you come down with a terrible illness and you're ending up spending hundreds of thousands of dollars, your insurance company if you take down state lines, then you have like not an infinite amount, but in practicality, like so many choices. I don't understand
who gained health insurance
rather than be a problem. Go somewhere else.
Sorry, you're out on the streets. Bottom line is, once again, the discussion, if you really think about the kinds of discussion that we're having, it is an absurd discussion for the wealthiest nation in the history of the world.
Senator Sanders, let me follow up on that.
I want to respond to that real briefly.
Please, go ahead.
You know, it's interesting sometimes the rhetoric that our friends on the left like to say that anyone who doesn't support government control of our health care somehow doesn't like and fit in whatever population you're talking about. But let's again go back to facts, and let's talk about young people. You know, there's no group in America, I think, that's been hurt more by Obamacare than young people. Young people were left on the chopping block. Let's talk about some basic stats. A recent study found that the Obamacare mandates, what Bernie just sang an ode to, have increased, the three costliest mandates have increased premiums for younger people by 44%. Without those mandates, the typical 21-year-old would pay $1,100 a year less. If you're 21, think about whether it would be easier to afford health care if it cost $1,100 a year less. And let's talk about some specifics. Before Obamacare, the most affordable plan that was available for a 30-year-old Texan, for a 30-year-old Texan woman was $470 a year. Today, under Obamacare, the cheapest plan that's available for a healthy 30-year-old woman in Fort Worth is $3,236. It's gone from $470 to $3,000, over $3,200. That's why young people are hurting. And what Obamacare did is it jacked up the rates on all the young people. Why do you think there's an individual mandate? It's to force young people to pay really high rates to subsidize the rest of the system. And if you don't pay it, the IRS fines you. And, you know, over 6 million people are fined each year by the IRS under Obamacare.
Senator, we're going to get to the question of fines and so forth in a minute, but I want to circle back to women's health and ask you, Senator Sanders, why should a 60-year-old male or women who are beyond childbearing years be required to have health insurance plans that have maternity care?
I don't think they should. But I do think that's one of the changes we might want to look at.
Okay.
But I do believe that in the United States of America, where we talk a lot about our love for children, that pregnancy is not and should not be considered a pre-existing condition. That every woman in this country who gets pregnant should be 100% assured that she is going to get the highest quality care she needs to deliver a healthy baby.
Senator Cruz, I want to stay on the issue of women's health. Under Obamacare, women pay nothing out of pocket for birth control. So will that continue under any Republican replacement?
It's going to be a choice for each patient to make. Listen, Obamacare is all about these mandates. And, you know, Margaret Thatcher famously said the problem with socialism is eventually you run out of other people's money. No! The same is true with the mandates. Every mandate, people will say, gosh, I'd like that. Imagine if the federal government mandated that everyone in America must drive a Lamborghini. Now, I've never driven a Lamborghini. I mean, they look kind of fun. But you know what? I'm willing to bet most of us, if that was the mandate, and it'd be cool, you said leather seats, you could go, I don't know, 200 miles an hour?
300.
What it would mean for most people is you couldn't afford a car. If they said, but, gosh, the VW Bug is not fancy enough. You need everything. For most people who can't afford it, it doesn't work. That's what Obamacare is doing. I would love for everyone to have maximum coverage on everything, but there's no magic fairy with pixie dust that gives it away for free. No. And these mandates are hurting people because it's putting people in a situation like LaRonda where they get nothing. They don't get health care of any kind.
You get nothing.
Their employees don't get health care.
That'd be perfect.
Because Obamacare has driven the cost up, and that's why people are hurting so much under it.
2 points. Our employees are not getting health care because in Texas, you did not expand Medicaid under the Affordable Care Act.
Well, she has 49 employees. She's not covered under it, and she's not hiring more because of
But lower-income people would be eligible for Medicaid. Second of all, I think that it is very clear that the discussion that we're having when Ted talks about mandates, I look at it differently. And also what we should be clear about is Ted says, well, there's just not enough money. We all can't drive fancy cars. I think it's a bit disingenuous to talk about driving a fancy car with getting access to health care when you're sick. Last point on this issue. If we repeal the Affordable Care Act, we are going to provide $346 billion in tax breaks to the top 2%. Ted, in other ways, goes even further. He wants to repeal the estate tax, which applies to the top 0.2%, the very wealthiest people in this country, and give them collectively hundreds of billions of dollars in tax breaks. Ted, we are the wealthiest country in the world. And it's not a question of everybody driving a fancy car, but it is a question to making sure that every man, woman, and child in this country has health care as a right.
I want to bring it back to a subject.
Let me respond to that real quickly. I know this gentleman has a question.
As long as you're not going to talk about the estate tax.
What Bernie said real quickly, I want to respond to just briefly. Which, it was interesting in the course of the campaign last year. I would encounter young people all over the country. There were a lot of young people who supported our campaign, a lot of young people who supported Bernie's. And I would talk with different people supporting Bernie. And I'd say to them, typically young people, I'd say, you know what, I agree with Bernie. And they'd sort of look at me, they'd be startled. They'd say, what are you talking about? I said, listen, Bernie talks about how Washington is corrupt, how both parties are corrupt, how both parties are in bed with big business and big money, and it is a corrupt system benefiting the special interest. I agree absolutely and entirely. And what I tell folks is where I disagree.
Buffering.
Bummer.
Isn't a solution. If the problem is government is corrupt, why on earth would you want more power in Washington? I want to take power out of Washington and empower the people. When it comes to taxes, what I want to see is a simple flat tax of 10% for everyone and abolish the IRS.
Well,
that ends the power.
We're all complaining about how corrupt the government is. That sounds a whole heck of a lot more responsible to me than giving health care in the hands of the government and depending on them to be responsible.
Unprecedented
our corrupt government that Bernie's always complaining about.
Ted's plan, according to the Wall Street Journal, would give incredible tax breaks to the top 1%.
Okay, we'll do another town hall debate on tax reform.
Good.
Okay, we're going to take a very quick break. We'll come back a subject where there might be some agreement. The debate continues with Senators Ted Cruz and Bernie Sanders in a moment. Stay with us.
All right.
So obviously, both of them are agreeing to that there's a problem, but obviously they're not agreeing to the solution.
Yeah, one's the capitalist, one's the democratic socialist.
Yeah. So anyway, what you were going to ask me about?
What did you do during the entirety of Election Day? Because I sat at a polling place because I was campaigning for some state rep. It ended up not mattering because the area was majorly Republican. But anyway, I was wondering what you were doing.
You were campaigning on Election Day.
Well, I was poll sitting. I was in front of the polling center, and I was trying to convince last minute voters to vote for the state rep.
It at the polling place?
Yes. You can't be inside. They have to be a certain distance away. They had a mark out in the parking lot, so we had to be on the other side of the mark. Okay. So we set up chairs and stuff like that. So
okay. Yeah. I was just at home on Election Day. There was a watch party at a United Auto Workers place, but I found that out like way after I was already too comfortable on my couch watching CNN. And it was about, I think it was officially called around 1:30. I went to bed at like 1 o'clock. I was too tired.
No, it was like more like 2 a.m. But like by 1, you could tell that it was going to win. Trump was going to win. So
something was wrong.
Oh, an Inception boy.
Yes, I have the Inception button. But yeah, like when I was at the Hillary Clinton office, I mostly did data entry.
Mm-hmm.
But I did do some calls, and I did do one canvassing session.
Impressive.
In the Delta Township, like the Grand Ledge, Delta Township area. It was okay. Some of the Bernie people came over to the Hillary campaign.
Uh-huh.
And that included myself.
Mm-hmm.
But it was quite enjoyable. But some were Bernie or bust, and they did not. So yeah, I guess yeah. So who was it that you were campaigning for?
Some guy. He was a pastor in Plymouth. His name is Jeff Noble.
Okay.
I've heard of him. What was that?
I've heard of him. Yeah.
You have heard of him?
Yes.
Oh, okay. So yeah, he ran for state rep, and he won because the district he was running in was predominantly Republican voters. So.
Yeah. I did help out a little bit with. What was her name? She was running against Tom Barrett.
Mm-hmm. Okay.
And at SSI, the representative is Tom Barrett. So I've been planning to run against him, but there have been some major changes in my life where that would prevent me from doing so.
Oh, you're running for state rep.
I was planning to, but that's not going to be the case.
Mm-hmm.
But yeah, on that note, the commercial break is over.
Sweet.
Yeah. Welcome back to the CNN debate on the future of Obamacare. Let's turn now to the rise in prescription drug costs. For that, I want to bring in Cole Gilroy. He's a father of 2 whose daughter, Juniper, requires medication that would cost $900 a month.
Thank you. My 3-year-old daughter was born with an undiagnosed severe heart defect.
Yeah, I have no idea where that's coming from.
Transplant when she was only 7 months old. Unfortunately for us and families like ours, our employer provided the most vital of my daughter.
It's coming from the stream. I'm not using CNN or CNNGo.com. Using something else.
Well, I'm not either. I'm using.
How would you like to address a healthcare system?
Let me play it then. Let me play it.
Get yours on.
Choose to not cover drugs that people like my daughter need to live.
So I guess what they're talking about drugs.
Question, and thank you for the care you give your 3-year-old daughter. I know that is not easy. And the question you ask is one of the great challenges facing this country, is we've seen the cost of drugs increasing dramatically. One area Bernie and I talked about, we agree on, is allowing the importation of drugs into this country from other countries where they're cheaper. There's no reason why we should be subsidizing other countries across the globe. But another fundamental area is FDA reform, where the costs of getting a new drug approved are prohibitively expensive. I don't know if you've ever seen, or folks have ever seen, the movie Dallas Buyers Club. It's a wonderful movie with Matthew McConaughey about a gentleman in Texas who had AIDS and wanted to get drugs to care for it, and the FDA wouldn't allow it here, and he would travel to Mexico, he traveled to Japan, he traveled all over the world trying to get life-saving drugs. There is story after story after story of exactly that happening. Life-saving drugs that are available, that are approved, they're used in Europe, they're used in Canada, and the FDA won't allow it. That's why I think FDA reform is so valuable, that if we lift the barriers to let people try, give you a right to try. If it's your life, you have a right to choose. You have a right to try. And the key to it is competition. Listen, the big boys, the big players, like government regulation, Dodd-Frank, benefited the big banks. Tough FDA barriers to entry benefit the big pharmaceutical companies. Massive complexity in tax laws benefits big corporations. By reducing those barriers, we have competition, and there's the opportunity. I believe we can have innovative cures. To give you a sense, the 4 most devastating diseases in terms of human life and dollars: heart disease, Alzheimer's, diabetes, and cancer. We ought to be investing everything we can to cure those diseases. Just curing cancer, an incredible achievement, would save $50 trillion and countless lives across the globe.
Thank you, Senator.
And the FDA is a barrier to doing
I like
that.
it.
We need to change that.
Senator Sanders.
Sounds like a plan to me.
Here's the simple issue. We pay, just as the case with healthcare, we pay, by far, once again, the highest prices in the world for prescription drugs. 15 years ago, you know what I did? I took a busload of women, working-class women from Vermont, dealing with breast cancer across the Canadian border. And they were able to purchase tamoxifen, a widely used breast cancer drug, at that point, it's changed, for 1/10 of the price they were paying in the United States of America. Tears were coming out of these working-class women's eyes, fighting for their lives. What's going on? What's going on is the pharmaceutical industry owns the United States Congress. And in all fairness, I will admit, it's not just Republicans. They have a huge influence over the Democratic Party as well.
Huge.
Now, the reality is, uniquely in the whole world, you can walk in tomorrow to your pharmacy, that the cost you pay for medicine could be double or triple, and there's nothing that anybody can do about it. So what do we have to do? We have to tell the pharmaceutical industry, which in 2015 made $50 billion in profit for the 5 major companies, where the top 10 executives made over $300 million in compensation. We're going to have to be very loud and clear and say, stop ripping off the American people. 2 things that we could do immediately. Ted, it's right. I introduced and will introduce and look forward to your co-sponsorship of legislation to say that pharmacists and distributors and the American people should be able to buy FDA-approved medicine any place in the world. That will drive down prices in this country, because then you'll have international competition. Second thing we need to do, and I believe it or not, I think even Donald Trump may be on board with this. It's hard to believe, but
throwing Donald Trump under the bus.
Negotiating drug prices through Medicare. Medicare spends zillions of dollars for medicine right now. Republicans language in some years ago, which prevents them from negotiating prices. I would hope Ted will join me in saying that Medicare should be able to do what the VA does. We can lower prices as well. But the bottom line here is, you got 1,400 well-paid lobbyists right now. And they're working, if I may say this, they're working against you, they're working against your daughter. The only thing they want is more and more profit. And they could care less about the needs of the American people.
Well, but Bernie, the barriers are also coming from government. And I'll give an example. A Texas constituent, Cassie Lay, has a 7-year-old daughter who was put on a feeding tube when she was 7 months old. And there's a drug called domperidone that is used all across the world to treat the condition she has called gastroparesis. She was put on domperidone, the 7-month-old girl. She was off the feeding tube. She was living well. Domperidone is available in more than 100 countries, including Canada and throughout the European Union. But the FDA has been aggressively enforcing an import ban here. And I'll tell you what Cassie's mother said. I fear she will need to get a feeding tube again. How do I tell her that? She's a little girl who has worked extremely hard to overcome her fears of eating, and now her joy of just being a normal little girl will be taken away. We shouldn't have the government putting barriers to people getting the drugs they need.
I think that's a fair point. And I think if you have a product...
They're growing a lot more than I expected them to.
By countries that have high standards in this area, I think you make a good point. But I think the more important point is that the government of the United States, representing the American people, has got to control the incredible greed of the pharmaceutical industry. Will you drink? I do appreciate the reimportation. I really do. And we can win it if we get Republican support. will you stand with me in saying that Medicare, which spends a huge amount of money for prescription drugs, should be able to negotiate prices?
Oh, listen, of course Medicare should negotiate, but you and I have a different view on how you control greed. Hold on. Let me finish what I'm saying. Your view, you said before that, gosh, these executives make way too much money. I don't think the government should be in the business of deciding what you get paid and you get paid and you get paid. And there are socialist countries on earth. There are socialist countries that you encourage us to be like. But those countries are not doing nearly as well as America. You know, the per capita income in America is over 5 times the average per capita income in this world. It's 50% more than the per capita income in Europe.
No. I'm buffering. Hang on, just give it a second.
I'm looking at the live
This is
chat
a land of opportunity
on your channel.
Social mobility in socialist countries.
Screw you, Andrew. Screw you, Andrew.
There's some guy who went on a huge rant about Bernie Sanders being a commie.
Like my dad did, and the free enterprise system in this country lets people rise. So I don't think the answer is government putting wage and price controls in and deciding how much of each.
Millions of Americans can't afford the medicine, while the drug companies are making incredible profits and paying their CEOs obscene compensation packages. Yeah, that does concern me. In terms of socialist countries, including Denmark and Sweden and Finland.
Have you seen Alex Jones' rant about the frogs during game?
I choose to live in America.
Senator Sanders, let's get back to
no,
America.
I know how crazy
yeah, Alex
Jones is.
Yeah, he goes on some crazy rant about a gay bomb. Turn the freaking frogs, Kurt.
Not to get health care.
And Obama's the part of the lizard people.
Are paying up to $2,000 per year for failing to purchase coverage. Many say that they can't afford the premium, so it's just cheaper for them to pay the penalty than get health care. So is it fair to put this tax burden on families?
No, it's not. But on the other hand, is it fair to not raise the revenue that we need to provide the kinds of benefits that we are providing? That is a way to do it. I don't think it's a particularly good way. I disagree with Ted, who wants to give, according to the Wall Street Journal and many other publications, incredible tax breaks to millionaires and billionaires. I think in the wealthiest country in the world, we should raise funds in a progressive way where the very rich are now doing phenomenally well. Yes, I do believe they should be asked to pay more in taxes. And I think we should use that money and other mechanisms to provide health care to all people.
Senator, on that very topic, the top 1% are paying a lot more in taxes under Obamacare. But if you repeal it, will the top 1%, the wealthiest Americans, effectively get a tax cut?
Well, Dana, let me point out that Bernie acknowledged that 6.5 million Americans are paying Obamacare tax fines because they can't afford insurance. So they can't afford health insurance, and then the IRS comes in and fines them. And he says, gosh, I don't agree with that. And yet throughout the Democratic debate, Bernie says he helped write Obamacare that imposes these fines on people. I think it's wrong to be fining people. But let me make a broader point on taxes, which is many times in this debate, Bernie has talked about providing health care for free from the government. You know what?
Wrong.
The simplest principle in economics is Tunstall. There ain't no such thing as a free lunch.
Mm-hmm.
The Liberal League Urban Institute scored...
Pay it through your taxes.
Those are your awards, not my words. Those are your words.
Free. Pay it through your taxes.
$2 trillion over 10 years. Now, how much is that? Trillions is a big number. It's not clear what that is.
Paul Sean Spicer. I didn't say it was free. You said it was free. Not my words. Those are your words.
We pay today.
Pay it through your taxes.
$1 trillion a year. $2.5 trillion means every one of us
Senator
paying
Cruz,
income
you know how
taxes
democratic
would have
socialism
to
works?
Triple what you pay in income taxes to get an additional $2.5 trillion. Now, Bernie, no doubt, is going to come back and say, no. None of you are going to pay. Just the rich.
And co-pays.
Every person that makes over $1 million a year and confiscated 100% of their income, took every penny that they make. That would raise only enough money to fund Bernie's plan for 5 months. Here's another idea. How about if we confiscated the assets?
Nope, I'm not taking this.
Google, Microsoft, Facebook, and ExxonMobil, if it came in, illegally seized those companies and sold them, that would pay for 1 year of Bernie's plan. If you don't want to see your taxes triple, in addition to the wait list, in addition to the rationing, in addition to fewer MRIs and mammograms to worse care, then you don't want to see Bernie's Medicaid for all. Wrong. You want to see cheap, affordable health care that you can choose, you and control.
He's got a paper.
Wall Street Journal, October 29th, 2015.
Whoa, zoom in.
Wall Street Journal, not my paper, your paper, maybe not.
Oh, no.
Ted Cruz's new tax plan delivers its biggest benefits to the top 1% of U.S. households, adding about 1/3 to their after-tax income. Here is the economic reality facing America. In the last
He pulled out the paper.
years, there has been a massive transfer of wealth.
At least it's not alternative facts.
To the top 1/10 of 1%. We're talking about trillions of dollars. Ted's response to that is he's going to support the repeal of the estate tax, correct? You're on record in doing
among many things, because I don't want
many
to
other
bankrupt
tax
farmers, I don't want to bankrupt small business owners.
That's not it. The only people who pay the estate tax are the top 0.2%. It costs us over $200 million. And as Ted said, it goes on and on. So this right-wing hyperbole about we can confiscate everybody, it's not going to do anything. Here is the basic point. If we pass the Sanders plan, 95% of people in this country would have more after-tax income than they have right now.
Senators, I'm sorry, it's clear we have a lot more to debate, and we can do that at a later time, but we have to take a break, and when we come back, closing statements about healthcare.
Yeah, the runtime was supposed to be only 90 minutes. Looks like it's going to go for a full 2 hours.
I think so.
Shocked by your wireless bill every month?
I'll mute this.
T-Mobile ad.
No, thanks. This is fascinating. This is really good stuff. I wish we had this for like any other debate. Like the discussion over policy has just been perfect. So
yeah, definitely. At least we're not talking about Donald Trump's size of his hands. So that's good.
Well, yeah, I think that part of the reason that this debate is so much more civil than the presidential ones is because this is about a specific policy, specific piece of legislation, whereas the other ones, they were literally campaigning against each other, so they had to go after each other's throats the entire time. But yeah, I really enjoyed this. And I feel like they're agreeing on a lot more than you would expect them to, considering their economic policies are polar opposites, but they have different solutions to what they agree are the same problems. So I appreciate that.
Yeah. Mm-hmm. Yeah, that reminds me. You remember Tim from SSI, right?
Tim Van Lowe?
Yeah.
Uh-huh.
When he and his wife and I think someone else. I don't know if he brought his whole family, but he went to the debate in Flint, the Republican debate in Flint. And what's so funny about that debate? That's the debate where they were arguing constantly, but it was like monkeys flinging poo at each other. But that was the debate where he brought out the size of his hand. That whole thing. That was hilarious.
Oh boy!
Hilarious.
So that's the one where like John Kasich's like, well, how about this? This is something, huh?
It's
right?
Like, hey, how about me? I'm the reasonable dude, and I'm not crazy. And yeah, if he won the Republican nomination, it would have been a completely different atmosphere as you know, the whole well, you know what Hillary Clinton versus John Kasich, what they would be saying, and how everything would be. You know what I'm talking about. At this time, seems like we lost connection with Caleb temporarily.
I'm back.
Oh, there we go.
I'm here.
Okay.
Oh, I don't see your face though. So.
Boom. There we go.
Yeah. You have to send me a link to your channel real quickly so I can go and check it out. I'm not subscribed to your other one yet.
Okay. I don't see your face. I see that ugly dude.
The ugly dude
from Illinois.
Well, that must be
Indiana.
Vice President Pence.
Oh yeah.
The joke is he's using lightning. So the joke, the satire around Mike Pence and his conversion therapy.
Oh God, I hate that.
Uh-huh.
I hate that.
I know. I know that.
Mm-hmm.
Although it's mostly myth around it. Yeah.
And I know people who think it will work.
Yeah, that's sad.
And they go to that same political camp as we do. Sucks. I'm gonna post it over the group chat really quickly. I'm gonna look for it. Sucks. Paste, and it's because I haven't gotten enough subscribers yet. It's like you got the youtube.com/channel/ and then a bunch of random stuff.
Right.
I still don't have your webcam, and I'm looking at the YouTube channel, and I don't see myself.
Yeah, I know. It should be back up in just a second because your Skype thing just came back up. So
there it is. All right.
There's your beautiful face.
All right.
And hopefully the stream will stop buffering soon. The debate live stream. Get back to that. I want to hear the closing statements.
And you take a step back and say, whoa, what kind of craziness is this? We are the wealthiest country in the history of the world. And yet we have tens and tens and tens of millions of people struggling with prescription drugs, struggling with basic health care. Yes, we can do better than that. And then on top of all of that, we end up spending almost twice as much per capita on health care as do the people of any other country. Now, what Ted is proposing is to make a difficult situation even worse. To my mind, Obamacare is a step forward. We have got to go further. But what Ted wants to do is do away with many of the patient protection bills, provisions that were passed, pre-existing conditions, a cap on what you have to pay, making sure that women are not discriminated against, making sure that young people can stay on their parents' insurance programs. Under Ted's idea, all of that is gone. You are on your own. I think that is a very bad idea.
Thank you, Senator. Senator Cruz?
I want to thank Bernie for being here and for being a vigorous and honest debater. He believes what he believes, and he represents it well. And I want to thank each of you for spending so much time addressing this critically important issue. I'd like to take a minute and actually ask the people here if the cameras could turn for a moment to the folks in the audience. I want to ask you, how many of you here in the last 6 years have seen your health insurance premiums or your deductibles go up?
Not me.
I don't have health care yet.
Let me ask another question.
It's under your
How
parents,
many of you here know somebody, including yourself, who's had your insurance policy canceled in the last 6 years?
Not mine.
If you look at these hands across the room, this is why people are so unhappy with Obamacare. Because it isn't working. Because it was built on an edifice of lies. When politicians promise the American people, if you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. And 6 million people get their plans canceled against their wishes. Those are broken promises. When the President of the United States promises your premiums will drop $2,500 and instead the average premium rises $5,000 and deductibles go up $5,000,
that has to be coming from you.
People
I don't
are
have
hurting because of Obamacare. And Bernie's solution, I'm reminded of an old Saturday Night Live skit with Christopher Walken, where they're playing in a band and he keeps ringing the cowbell. And every time they record it, his solution is more cowbell, more cowbell. It was government control that messed this all up. And Bernie and the Democrats' solution is more cowbell, more cowbell. Yeah, it didn't work when we said you wouldn't get your plan canceled. Yeah, it didn't work when we said your premiums would be cut. But give government even more power. We can do better. I believe we're going to honor the promises we made to the American people.
It's democratic.
And we're going to
socialism.
repeal what Bill Clinton called Obamacare the craziest law in the world. Instead, we're going to give you choice, let you buy insurance across state lines, expand health savings account, make insurance portable, block grant Medicaid to the states so you can have experimentation health savings accounts so we can meet your needs, put you in charge of your health care with your doctor, not government. That's what this election was about, and now it is incumbent on all of us, Republicans and Democrats, to deliver on the promises made to the American people.
Our thanks to Senators Cruz and Senator Sanders for joining us here tonight.
And we also want to thank our audience here, our hosts at
Very welcome.
the George Washington University. CNN Tonight with Don Lemon picks up our coverage right now.
I wish there would be post commentary and as well. I like that. I really enjoyed that. I'm so glad that I had a lot of expectations coming to this debate because I feel like these are two people who are very policy centered. Both have a lot of positive motivations that can be attributed to what they're wanting to have done in politics. So I really like seeing them go head to head, and I felt like they can sympathize with each other because they both had very positive motives behind wanting to implement what they are wanting to implement. So, that's. Have you heard of Rand Paul's budget that was going to be in replacement of Obamacare?
No, I mean I've not heard of it specifically.
Yeah, but
I've heard that Ron Paul has something.
It was Rand Paul, and he tried proposing it to the Senate, and they voted it down and got it was hugely popular among libertarians. And he gave a speech, basically, what's the term? Condemning the Republican Party for why are you implementing this budget when we're supposed to be the conservative party, and it never balances out. So,
well, I
voted for the Rand Paul budget, so I was happy to see that.
So, what Ron Paul, is it Ron or Rand?
Ron is his father.
So is Ron Paul?
Or Rand Paul.
Rand Paul. Oh, so what Rand Paul is trying to say is just to completely get rid of the whole thing and then just forget about it.
I don't like Rand Paul's solution necessarily because I feel like, as Ted Cruz mentioned, there has to be some policy to keep insurance companies in check. But for the most part, they'll do. Besides them being entirely greedy in a few aspects, the free market should be able to keep them in check, and that's why removing the state lines would be a good idea. Hillary Clinton even agrees with that. So that's what I would like to see happen. Fortunately, it can. So then anybody can get any insurance provider they want. So if they don't like their insurance, they go get another one. Or not their insurance, their health.
Yeah.
So.
Okay. Well, I remember when I was looking for health insurance or something like that. There was quite a bit of different options, at least in Michigan. But I don't I remember I was just curious, so I went to the Obamacare, our healthcare.org, and was just curious, how much would I have to pay for it? And it was not $2,300. That was just not. That was not the case. It was there were many different options with the co-pays and then the premiums. They were all different, but
they might have increased since whenever
I would have paid $20 a month, $20-$30 a month for health insurance.
Have they increased since? Okay, well,
I mean, that was the I think that's called the premium, what you pay per month. Mm-hmm. The copay was $2,000. Mm-hmm. I could have paid $100 a month for health insurance with the copay being $200-$300. Mm-hmm. So that it goes, that it seesaws back and forth, and with what you would pay. But what Bernie is just trying to say is that if all 320 million Americans, they pay an additional 2 to 3% in taxes, but then they don't have to. It's not in addition to the co-pays and premiums. Mm-hmm. That goes away completely. You fill out your 2040, you pay your taxes, and it's taken care of. If you break your leg, it gets taken care of. If you have to go to the emergency room or urgent care, you don't have to pay a $200, $300, $500 bill for a doctor checkup. With the big concern about that, it's very that the price of health insurance or just the costs are increasing. I mean, yeah, that's a very big concern, and one of the reasons why health insurance is so expensive, and that the paying for health insurance is so expensive is because when you're forced to pay into a private insurance company, the private insurance companies can raise their prices because they know you have to pay them money. And I do think is a major problem. And so when we do a single-payer healthcare system and implement those regulations, then that won't be a concern. Where you have health insurance companies raising the prices of health insurance because they know you have to pay health insurance to them. Mm-hmm. If there was a public option, or if it was a single payer healthcare system, we wouldn't be dealing with these issues. You know what I mean? Yeah. And so when Bernie Sanders is saying, or when I'm saying that the health insurance companies are the problem, this is what we're talking about. If we give the health insurance companies more wiggle room and more freedom in this issue or in this topic, they will raise the prices because they know that people have to pay them in order to survive. And so, with democratic socialism, we don't believe that every aspect of life needs to be controlled by the government. We don't believe that we should regulate prices on the shop down the street. That's not what we're talking about here. That's not what we believe, and we should not be compared to radical communism for something like that. It's just that for certain aspects of our lives, like when it comes to healthcare, when it comes to paying for college, that should not be in the hands of corporations where the corporation just wants to make more money. We believe that most corporations, they care about their bottom line and nothing else. And if that's the case for healthcare, if that's the case for our education, then the prices of those services are going to go up, exponentially. And so that's what it just comes down to those basics there, and that's why we progressives or liberals don't believe in libertarianism, because then it just allows the corporations to screw us over, and then we have this dilemma.
I mean, in theory and concept, that sounds like what it is, but that's not.
And it's been proven to work. That's what we're also trying to say, that it's been proven to work in dozens and dozens and dozens of other countries in the world.
Socialism?
Democratic socialism.
Oh, well,
we got like England, France, Sweden, Spain, Portugal, Japan, South Korea, Russia.
the scenarios Ted Cruz referenced. I mean, you can consider that cherry picking, but
those are a lot of countries, and those are and when you do all the first world countries in the world, that's practically all of if you take practically all the countries, all the first world countries, that's all of them. Now there's a total of about 300 and so countries, depending on who you ask, in the world, but not all of them are first world, and not all of them can sustain, single payer healthcare or all these different programs. But the United States is the richest country in the world, but yet smaller countries, poorer countries, or let's just say smaller countries that have less GDP, they can easily sustain single payer healthcare, and they don't spend all this money on other things. Yes, their taxes, they have significantly higher taxes, but the people in those countries know exactly where their money is going, and they're perfectly okay with that. But in America, it's part of the culture where just people just don't want to change or this and that, and they want to make with the problem I have with America, with American culture, is that many people they make their money and they want to keep all of it, and that's the be all end all, and that's it. That's probably one of the major reasons why people
is that philosophy.
What?
The taxation is that philosophy.
Well, I do not believe that taxation is stealing from somebody. I do not. It is someone's it's a responsibility, and it's not government taking money from you. If that was the case, then I wouldn't like my money or my parents' money or my grandparents' money, which go to paying 2 wars that have not been paid for, to the Iraq and Afghanistan, and we pay massive amounts of money to the military-industrial complex. We don't want that. We don't want trillions of dollars being spent on that. Yet we complain about that, but that doesn't mean that we should just stop paying our taxes. Yeah.
I'm not the taxation is that philosophy, but I don't know. I feel like 40%, when you talk about most taxes that the top 1%, which Bernie Sanders always references, pays, that totals up to 40%. So it's not just simply them not wanting to. It's not simply them wanting to keep their money. It's them simply not wanting massive amounts of government intervention. And we can talk about more tax increases for the rich. It just, I don't know.
Many people in the top 1%, when they make their money, they want to keep their money, and
also,
they don't want the government getting in the way of their business.
Another misconception about the top 1%, though, is that it's a group of people. People are moving in and out of the 1%.
Oh, I know. Yeah, I know.
So it's not there's not this group of people who are just wanting the government to stay out of their business entirely, just so they can keep their money and stay up there. But
in order to get to the top 1%, you have to be making a lot of money. And the vast majority of rich people are their first generation rich people, but that doesn't mean that's not an excuse for them to
want to spend only 40%.
No.
The government.
What I'm trying to say is that we are all Americans, and that we all have a responsibility for each other, and that it doesn't matter if you're a pastor at a church, or you're going to school, or you're a CEO, or you're a janitor. We're all Americans, and that that we have a responsibility for each other.
Right. And
after during World War II and after World War II, that concept was in place, and that under Eisenhower, especially to just pay off all the debt from World War II, the top 1% was paying 92% of their income tax, or of their income into tax.
Mm-hmm.
Yet the top 1%, they were living it out. They had they had vacations. They had lots of money.
Carlos, that sounds like
they had lots of influence.
That sounds like a morally reprehensible. Wow, what word am I looking for? Reprehensible, morally reprehensible concept that you're taking 92% of somebody's income away from them. But
that's not what I'm saying we should do.
The bottom line is, I agree with your philosophy that as Americans we are to care for each other.
Yes.
So, but nonetheless, I don't think that the way to do that is government redistribution of wealth. That happens at the end of a gun. Then that's not charitable acts. That's not representing of the spirit you're saying that we as Americans should embody. That's saying the government's going to say, if you don't pay your taxes, then there will be punishment. So.
I do believe if you are guilty for tax evasion, you should be punished for that. There should be no question on that.
I agree, but that doesn't mean that I feel like saying that taxes are justified and tax evasion should be punished as two different arguments. But okay, well, the bottom line is, despite all this, there's two different philosophies. I feel like there's the same problem, there's the same moral principles involved, but there's two different philosophies and how
two different solutions.
Yeah, and Sanders and Cruz definitely embodied that the
two different solutions.
So
now, one of the things that I noticed with Bernie Sanders is that Bernie Sanders is willing to admit problems that his side have caused. He's willing to admit that there are certain problems in Obamacare and things like that, but at the same time, he has what I think a logical solution to that problem. And you've heard him say yeah, that's exactly right. There's this is a problem in the Affordable Care Act, and that we should fix it. But one of the things that Bernie Sanders should have said, which I don't know if he said or not, was that Democrats would bring up this solution to a problem in Obamacare, but the Republicans would shut it down. I don't think the Republicans trying to repeal Obamacare 70 times. They shouldn't have been doing stuff like that.
Right.
If you got a basket of apples, and if you got that one rotten apple in that basket of apples, you should replace that and not dump the whole basket of apples because of that one rotten apple. You know what I mean?
Yeah.
Republicans should use their
Republicans
skills.
Felt like there was a lot more bad apples, but they still want to preserve the good apples, and that's why Ted Cruz is talking about some of the good parts of Obamacare that he was wanting to keep. So
it's just that Republicans.
I'm having to go, Dominic,
all right.
But I agree with you. I think that not in the entirety of Obamacare should be repealed, and I think Ted Cruz agreed with me with that. But I really enjoyed doing this with you tonight. If there's ever any other debate like this again, we should end up doing this again. So, all right, I'll talk to you later. Thanks for joining with me tonight.
And also, don't forget.
And his name is John C.
All right, I'll see you later.
I'll see you later, Dom. Bye.
Bye.